Every parent knows the fear that their child who has cancer might not survive the illness. And when that moment actually comes, when the doctors treating you say that a cure is probably no longer to be expected, then it's almost unbearable. But as difficult as it is, for you as parents, it's now about finding a way to deal with this new reality. Regardless of whether your child will pass away soon, or if it's a course of illness where there's more time left. When there's likely no prospect of a cure, many new questions will come up for you. For example, how do we, as parents and as a family, deal with this? Where can palliative care be provided? What support does our child need now and as the illness progresses? How can we fill the remaining time we have together with as much life as possible? And what decisions need to be made now? The following videos are designed to give you an initial orientation on topics related to the palliative support of your child, which are now becoming important. But before we get into the individual topics, let's first talk about what exactly is meant by palliative support and what the goal behind it is. After all, not everyone automatically knows what the word palliative means. So to begin, let's first clarify the question. What exactly is palliative support or care? Palliative means that the goal is no longer to make someone completely healthy, but rather the goal is to have as much good quality time as it is possible. Above all, the focus of palliative medicine is to care for your child in a way that discomfort and pain are kept to an absolute minimum. Furthermore, everything that contributes to well-being is important, and everything that means quality of life for your child and for you as a family. So it's about truly comprehensive support. That means both in the medical and nursing fields, as well as in social, psychological, and spiritual matters. I can say from my own experience that this support gave me and my family a great deal of strength during my most difficult and darkest times. That was when I, as a father myself, lost my little daughter to cancer a few years ago. She passed away at just 9 months old from a brain tumor. That's why I can really relate to some of the thoughts, questions, and feelings that you might be dealing with right now. So remember, you are not alone during this difficult time. Not alone with your decisions, not alone with your fears, and not alone with your grief. Your treatment team and the palliative team, they are there for you. Yes, and they always try to find the best possible path for your child and for your family. They will support and guide you as best as they can through this phase with all of their knowledge and experience.